Podcast, the show where we examine the latest trends affecting radiology. I'm your host, Chris Hobson, and today we'll be talking with Nathan Coleman, MD. Dr. Coleman is currently wrapping up a neuroradiology fellowship at Massachusetts General Hospital, after which he will serve as neuroradiologist at Radiology Imaging Associates in Denver. Dr. Coleman, thank you very much for joining the podcast today.
Thanks so much for having me, Chris. I'm looking forward to our conversation today. Just in the interest of full disclosure, I kind of come to this issue from the perspective of a radiologist, certainly, and a patient advocate that has occasionally read and maybe written on some of the pertinent topics, but certainly not as someone who has formal economics or public health education or anything like that. So hopefully this is something that is accessible and helpful for anybody who might be listening in.
Absolutely. I think there's a lot of people in that boat. So I appreciate you managing expectations there. Well, today we'll be talking about the two very related topics, price transparency and the related topic of balance billing. And so my first question to you is just really, they've grown in importance. These two topics have grown in importance over the years. And I just wonder if you could give us a basic idea as to what the two concepts are and how they're related.
Sure. So price transparency in healthcare to me is basically just what it sounds like. It's the idea that a patient will know ahead of time what their out of pocket expenses are going to be for any particular episode of medical care that they receive, preferably at or before the time of delivery of care. There are a lot of reasons that some of which we'll probably get into why this is much more challenging than it sounds superficially. And then balance billing has also been referred to as surprise billing, or I think Dr. Richard Heller always refers to it as surprise insurance gaps. But that's basically what happens when a patient receives care from a physician that is outside of their insurance network. And when that happens, that means that a patient, that means that bill is not going to be fully covered or covered to the extent that it would normally be by the insurer, and then the patient gets stuck with a much greater than expected bill, or at least that's how that generally unfolds. There are a lot of reasons that can happen, some of which are often not evident until well after the episode of care has occurred.
Well, before we get too far into the discussion, Dr. Coleman, we should probably say a little more about private insurance, particularly because private insurance companies negotiate payment rates with hospitals, which can affect price transparency in particular. Can you please talk a little bit about how this process makes it harder for the average patient who has private insurance to gain a fuller understanding of the cost of certain healthcare services they may receive, like imaging?
Sure, I'll do my best anyway. And as I kind of mentioned, there are a lot of different reasons why it can be challenging for a patient to know, or their physician to know ahead of time what their out-of-pocket costs are going to be. As you mentioned, private insurance companies negotiate ahead of time with all sorts of different medical care providers, different medical systems. They negotiate with them ahead of time and privately to establish how much they're going to reimburse for any particular type of care, imaging, or procedure that a patient may receive. So what that means is that those hospital systems and those physicians are also adjusting what their prices may be, in order to maximize leverage with the insurers. There's something that hospitals have called a charge master list that basically every system has, that is just what it sounds like. It's essentially a menu of the prices for any potential type of care that they receive, all the way from just a Band-Aid in the clinic to the price of a major procedure. The problem with that, and I should say, as of a couple of years ago, it became federally mandated that hospitals post that information I believe post online, but it has to be accessible to patients. The problem is those prices that are listed in the charge master mean next to nothing in terms of what someone could be paying out of pocket for any type of care. Again, because that is dependent on the negotiations that the insurance companies made with the hospital system ahead of time. It depends on the specific health plan that a patient may have. And there, can even be additional layers of depending on the because most people receive their health insurance through an employer, so there may be an entirely another level of negotiations that the employer is having with the insurers for what kinds of plans are available to their employees, and what this all kind of adds up to is something that for me almost calls to mind the old show Whose Line Is It Anyway. Their tagline is the show where everything's made up and the points don't matter. That's kind of what always comes to my mind when I'm thinking about price transparency and pricing in healthcare, because so much of it really ultimately in terms of what the end costs are, certainly to the patient anyway, basically are arbitrary in a way. They kind of just are dependent. They're completely dependent on how the negotiation process goes between sometimes very, very large healthcare systems and those similarly large healthcare or health insurance companies rather. And that can introduce all sorts of other factors into the discussion as well. You can really get down into the weeds with the economics of how that works, where you have consumers in quotes, I guess, being the patients who are not paying the direct cost of the product, being whatever care, and but you have these in some cases national or level corporations that are negotiating amongst themselves for how much this is all going to cost. And so ultimately what that comes down to is nobody really knows what anything is going to cost, at least in terms of the price that a patient may pay out of pocket. That's another important distinction. At risk of getting too long-winded, it's important to keep in mind here that while we use the terms interchangeably a lot of the time, the cost, meaning the actual cost that it takes to deliver a type of medical care, for instance, a CT scan, the cost that it takes, the cost that it takes for a patient to be at the imaging center and get scanned physically at the scanner, for the radiology technologist to be paid to perform the scan, and for the radiologist to interpret that imaging, is at frequently completely separate and has little bearing on the actual price that is listed on the charge master that whatever hospital system may have that is setting that, and B, also may be completely irrelevant to ultimately the amount the amount of reimbursement that is negotiated with a particular insurance payer. So that was a pretty long-winded way of addressing that question. Hopefully somewhere in there it was at least partially answered. But I mean, the long and the short of it is that this is a really a complicated topic, and it's complicated not just for patients, but it's challenging for physicians and people who are in all parts of the healthcare system. It is just, it's challenging to navigate, and it's challenging for any one person to have all the answers here.
Well, it's interesting because you had mentioned just now that's one, I think it was maybe 2 years ago, it rose to the level of being federally mandated, publishing charge master lists, right, and things like that. So why, I mean, why, I guess, I guess you've already partially answered it. My next question is, why has this issue rose to such prominence? Do you get the sense that it's a critical mass of, no, I'm sure patients, but also now physicians starting to kind of get behind this issue slowly but surely? Or what is your sense on the ground as a doctor yourself?
Yeah, well, so there's a lot of components to that, because certainly, as you mentioned, it seems like there's been a fair amount of discussion in the news and at the national level regarding, at least somewhat tangentially, some of these issues. Number one, price transparency is an issue because it's a patient care issue, right?
Mhm.
Patients shouldn't be having to empty their bank accounts. They shouldn't be going bankrupt, because they are getting unforeseen medical bills because they get sick. I think most people pretty unequivocally agree that that's not a good thing. That's something that shouldn't happen.
Yeah.
And there's a lot of debate, and you can haggle back and forth about to what impact medical bankruptcy actually has on people and that sort of thing. But certainly that's clearly an issue for at least some fraction of patients. And another issue is just the fact that healthcare costs in general are getting a lot of attention because since at least the last few decades, basically, healthcare prices and subsequently healthcare spending as a fraction of our gross domestic product, it has only increased. And so people are paying more attention to that issue generally and trying to find any potential solutions to that continued increase. And whether or not price transparency in and of itself is a means to that end is very much up for debate. But certainly it kind of falls into the realm of that conversation, and I think is also part of why it's getting a lot of attention.
It makes total sense. Yeah, I've only seen this issue grow ever since I was even made aware of it. So I think we're kind of on that maybe incrementally upward trajectory on that.
Yeah,
Um, yeah. So I guess again, you've touched on it, but specifically with regards to radiology, maybe even anecdotally or in your experience, how does how have you seen it affect radiology patients in particular, or maybe it affects all patients the same way? I'd be interested
sure.
to know.
Yeah, and I think this is something that is a particularly challenging issue for radiology, because as the radiologist, unless we're certainly if we're performing a procedure where we're face to face with the patient and conversing with them, we may see firsthand, you know, what the patient is dealing with, or may discuss that with them. But in so many instances, our patients we aren't seeing them in real time. We're
Yeah.
interpreting imaging after the fact, and medical billing is itself a retroactive process, which is probably also part of the issue with all of this, is that we've established in this country that that the way our healthcare is paid for is a retroactive sort of process. So that kind of is its own separate issue. But certainly it's challenging, I think, from as a radiologist to always feel like you have a finger on how a particular imaging study is going to impact a patient, because you don't have that firsthand interaction with the patient. That said, certainly, I think most of us probably can think of anecdotal examples in our lives where, broadly speaking, the cost of medical care has impacted friends or family. And certainly in radiology, most of what we're doing is not cheap. Unfortunately, even the quote cheap imaging modalities, it can still be um, uh, well over $100 for an X-ray. Certainly, if you're talking about more advanced modalities, ultrasound, CT, MRI, those are big, expensive studies that are performed with very expensive equipment that require very educated people to perform the imaging, and obviously a physician to interpret the results of those that imaging. So I guess that was a roundabout way of saying that I think in radiology it impacts our patients probably similarly to patients in any other specialty or any other medical setting. But I think there's probably an added layer of difficulty as a radiologist, because depending on how in tune you are with your practice's billing process or your health system's billing process, this may be something that completely flies under your radar. If you're a radiologist who is employed by a large healthcare system or works for an academic center, that you may never really even see that side of of the equation. It's probably a little bit different if you're a radiologist who's part of who owns a share of your own practice. You may be more involved in your billing mechanisms and your billing department, that sort of thing. So you may see a little bit more directly how this impacts patients and the interplay between the different health plans that people may have. But it's unfortunately even in the ideal situation, it's something that can be convoluted for physicians to understand. It's certainly not something that we get formal training in, and it's not something that's readily apparent when we're actually having our most important interactions with the patients, which is providing care, whether that's again retroactively as image interpretation or in person, performing a procedure or something of that nature.
Mm-hmm. So so much of health, I guess, price transparency and balanced billing can be viewed through that personal lens, but it's also tied up in these much broader areas of health policy and healthcare spending. And I'm wondering if you can just zoom in a little more on that, like it's not obvious that I think the way you've laid it out is so clear how it negatively can affect individuals, but it's such I have to imagine a lot of it's an occasion for maybe just not the most efficient spending in the world, or the most
that might be an understatement.
Yeah. So I mean, so how do we get at that, or how do we even just get our arms around such an issue? I mean, do you have any sense? Again, we're going from specific to abstract, but from the meta sense, give us a sense of this problem.
The broader sort of public health side of things that you are alluding to. There's actually a decent amount of research out there now about price transparency and how it can impact competition or costs, or certainly patients' choices that they make. And unfortunately, I think the picture is probably muddled at best in terms of how much price transparency can act as a conduit to more cost efficient delivery of care, to improving competition, that sort of thing. Part of it is, again, just the convoluted nature of this whole beast that we've talked about. Part of it is the fact that patients themselves are not, you don't shop for healthcare the way that you shop for I don't know, canned vegetables. It's anything. Not it's a totally
literally
different
anything
process, right? So obviously patients don't always know what constitutes high value care, right? Because ideally, through price transparency, you want to maximize value for the lowest costs at which that a certain level of quality is achievable. So we don't always know what that looks like as physicians, so as a patient, it's incredibly difficult to know who hasn't had formal medical training, or even if you're a patient that has had formal medical training, it can be really hard to know in advance what that looks like. And so even when that information, again, when we have charge master prices are posted online, people can access those now. There are some pricing tools out there, different software programs that either some health systems or patients individually can access to put in what's your insurance information, what procedure are you having, how much will it cost to receive that out of pocket for you. But even when those tools are available, it can be really hard to know what patients for patients to know what to do with that information. And then there's also the component where sometimes you don't have a choice. If you're in an emergent situation, you're going to either, because you're physically going yourself, or an ambulance has showed up and is transporting you somewhere, going probably to the closest available site that is able to provide the care that you need. You're not sitting down doing several hours of searching on the internet to see, okay, who can do this cardiac catheterization, who can provide this head CT on an urgent manner at the lowest cost. You're just trying to get it done. So there are a lot of reasons why I think price transparency as a vehicle towards improving competition, lowering costs, all of that is maybe not the sort of panacea that I think occasionally it's been made out to be. But that doesn't mean that it's not something that we still need to strive for. So
That's very interesting. Yeah. I mean, you made some gestures there about, a few maybe minor ways that radiologists can begin to pivot towards more price transparency. You and I work on a blog series together, which I'm going to shamelessly plug at the end here, a price transparency blog series through acr.org. And I just our most recent entry in that was from Children's Hospital of Philadelphia, I believe it was,
yes.
where they moved benefit specialists to the front line. So the people who are probably most knowledgeable about this, they moved them right up there ahead of even scheduling. So that I just thought that was one really interesting. Obviously, that's a big effort to make that happen, but that's something within the scope of a lot of practices to be able to do that. Do you have any other ideas or like that, or is that a good, do you think, place for people to start, is even just reading that blog post?
Well, certainly, in the interest of shameless plugging, I would suggest everybody go check out that blog post. But yeah, I mean, I think that's one of the best examples that I've seen of what are some things that we can do within the framework of how we currently operate, to try and empower patients with some of that information ahead of time. I think Dr. Summer Kaplan, I think, is who kind of helped head up that program at CHOP, or at least who has written it up, I think, for the ACR now and in the blog. As you said, it's I think the key part there is that's something that's happening in advance of even scheduling, because that could have an impact on a patient's financial situation. If again maybe they're about to hit their deductible, maybe it's something that they should make sure that they schedule it before the end of the year, and that sort of thing. So it's something that needs to be a proactive process rather than reactive. And again, I think it can be challenging depending on the setting of that you practice in. But if you are part of a system that is willing to make efforts in those areas, or if you are part of an independent practice, I think that is something that you can strive for to really give patients as much agency as possible. by bringing that to the forefront and the beginning of your interaction with them. Again, as you said, this is something that they are that CHOP is doing at the beginning of their process. This is how they kick everything off, rather than, you get a bill in the mail 6 weeks after the fact. Certainly that still happens, but so that there's some concept ahead of time. And I think that's probably the best that in general we can hope for and strive for. Certainly, I think putting costs and prices, things like that online are all worthwhile. It just doesn't always mean much ultimately to the bottom line when everything's said and done. There are other models out there. That are not, I don't think they're widespread. There are certain small places around the country that I've read about, places that will do that do basically direct billing. They don't take any insurance at all. It's basically just you pay cash for X amount of dollars for X procedure or X imaging study. And if you are a radiologist or a practice that owns imaging equipment, you could certainly do that. And I think there is, I can certainly understand why both practices and some patients, why that is very appealing. That doesn't make a lot of sense, I think, at scale, because just by definition, any patients that are pursuing that option, they have to have a certain amount of disposable income.
Right.
Because as we mentioned, imaging, even if a practice owns equipment and is able to, maximize efficiency and keep costs low because they're not bringing in third parties, or they're not having imaging performed at like a big hospital system, which is inherently more expensive. It's still like you need a decent amount of cash to be able to do that. I mean, that's why health insurance started in the first place, is because these things are just by nature expensive, and a lot of people don't have that money just laying around. So
right.
In some contexts, that can be an option, but it's not, certainly not any kind of global solution, I don't think.
Thank you so much, Dr. Coleman, for all of your insights. This has been so helpful to so many people today. And I'd just like to encourage our viewers, if they'd like to learn more about the topics of price transparency and balanced billing, check out our blog series, like I mentioned earlier, at acr.org/price-transparency. Again, that's acr.org/price-transparency. And we've actually been maintaining that blog for several years now. So you'll see some interesting evolution going on there. And Dr. Coleman, if people want to find you online to discuss this and to maybe continue the conversation, can they find you on social media? And where?
Twitter is mostly where I'm active. I'm ncolemanmd. Also, you're welcome to email me at nmcoleman13@gmail. I'd love to continue the conversation.
Absolutely. Well, it's an evolving conversation, so I'm sure you'll have a lot to talk about, and hopefully you'll come back and discuss any updates with us.
Yeah.
Excellent. And when you're out in Denver. So, and for our viewers, if you have any ideas for future show topics, we really welcome them. And please do let us know on Twitter at the handle @radiologyacr. I also invite you to check out all of our past episodes at Apple Podcasts, Spotify, Google Podcasts, and be sure to subscribe to ACR's YouTube channel to see our latest episodes. Thanks again, Dr. Coleman. This has been wonderful. Really appreciate it.
Yeah, thanks for having me.
Absolutely. And thank you so much to our listeners. This has been the ACR Bulletin Podcast. See you next time.